Hey everyone, so if you're a radiology resident in India, chances are you've heard whispers about the MICR exam. But man, trying to find clear, simple info on it can be a real pain, right? Well, today we're going to pull back the curtain and figure out exactly what this exam is, and more importantly, if it's actually the right move for you.
Right? I mean, everyone talks about the FRCR. You hear all this chatter about the EDiR. They feel like the huge international gold standards that everyone's chasing. But then there's this other acronym that just keeps popping up, MICR. So what is it? And, does it even matter when you stack it up against these big international exams?
All right, first things first. Let's just demystify this thing once and for all. What does MICR actually stand for? Who's running the show, and why does it even exist in the first place?
Okay, so MICR stands for Membership of the Indian College of Radiology and Imaging. It's run by the ICRI, which is the academic part of the IRIA. That's the Indian Radiological and Imaging Association. To put it simply, it's a qualification that's designed by and for the Indian medical community.
The best way to think about the MICR is as India's own parallel academic certification. It's not trying to be the FRCR or replace it. It's serving a similar purpose, which is to officially recognize a high level of academic knowledge, but it's specifically tailored for the Indian system.
So why was it even created? Well, the main goals are pretty straightforward. It's here to set a kind of national benchmark for radiology knowledge, to really push for academic excellence, and, this is a big one, to give residents a clear, structured way to learn during their training.
Okay, so we've got the what and the why covered. Now let's get into the how. What does this exam actually look like? Let's break down the blueprint.
So the exam is going to test you in 3 key areas. It kicks off with a theory part. That's usually your MCQs or maybe some structured questions. Then it moves into image-based questions, where they're really testing your spot diagnosis and interpretation skills. And finally, the whole thing wraps up with a viva, or practical, which is all about discussing cases and proving you've got a solid grasp of the core concepts.
And here's what might be its biggest selling point. The microsyllabus is specifically designed to line up with what you're already studying for your MD or DNB, so you're not learning a completely separate curriculum. The exam is built to complement and test your core Indian residency training, not add a whole new pile of work.
So, this all leads to the big question, right? How do you actually prepare for this thing? If you're thinking about taking the MICR, what's the smartest way to go about it? Let's walk through a simple 4-step strategy. First up, you have to strengthen your basics. Go back to your standard textbooks, dig out your residency notes. That's your foundation. Second, you've got to integrate daily image practice. Make it a habit to do spotters and discuss cases. Third, use MCQs strategically. Don't just do them for practice. Use them as a tool to find your weak spots and fix them. And finally, for the Viva, you have to practice speaking your answers out loud. Focus on being clear and structured.
All right, so we get what the MICR is all about on its own. But how does it really stack up against the big international players like the FRCR and EDiR? Let's put them side by side and see what's what.
When you look at the key differences, it becomes really clear they serve different purposes. MICR is totally India-focused. FRCR is UK-based, and EDiR is European. But the most important difference is the focus. MICR really emphasizes academic theory. FRCR, on the other hand, targets advanced clinical practice, and EDiR zeroes in on your clinical reasoning. This difference also explains the difficulty. MICR is considered moderate, while the FRCR, well, it has a reputation for being extremely tough.
So, we've covered the what, the why, and the how, and that brings us to the final, and honestly, the most important question of all. Should you take the MICR exam? Is this the right move for your career?
So who is this for? Well, the MICR is a fantastic choice if you're academically inclined. If you love teaching, or you want a structured way to revise for your MD or DNB, or you're planning on building an academic career here in India, it adds real weight to your CV. But, and this is super crucial, you have to remember 2 things it is not. First, it is not a license to practice. And second, it will not replace the FRCR or EDiR if your goal is to work abroad. It's just not